Watch this.
Well, Idaho's law-mandated first-ever election audit is almost in the books. On Wednesday, a group made up of members of the Idaho Secretary of State's office and representatives from both the Republican and Democratic parties, they set off on a three-day mission to hand-count thousands of ballots in randomly selected counties. And in those first three counties, that would be Ada, Idaho, and Payette, they went through more than 8,300 ballots by hand, and they found a total of 10 issues, most of which were human error, specifically ballots that weren't filled out correctly, either not read by the machine or weren't correctly entered by hand. None of those issues, by the way, were in Ada County. Yesterday, they were in Jerome and Bonneville counties. And in Jerome County, teams found 3 issues there. 2 ballots had light marks on them. Third was an accessible ballot that was not retrieved. Not sure exactly what that means. In Bonneville County, only 1 issue there, but it was confusion with a spoiled ballot, so really no issues at all in Bonneville County. Today, the group is wrapping up the audit in Kootenai, Bannock, and Madison counties, and we should get those results on Tuesday. All right, well, every day we ask you to join the 208 conversation. Unfortunately, we don't always have the time at the end of the show to share all the text messages we get every day, which is why we've chosen to use Fridays as a kind of week in review and a chance to share your unshared takes on certain topics. So let's start with Monday, when a group of Nampa High School students took to the streets to protest the school board's decision to permanently remove 22 books from libraries across the district. Award-winning books like The Kite Runner, 13 Reasons Why, The Perks of Being a Wallflower, and The Handmaid's Tale, just taken off library shelves forever. The trustees decided this during their May 9th board meeting. Based on complaints, these books contained quote-unquote pornography, even though some of them contained nothing more than kissing scenes. Well, this arbitrary removal is why some students, these students, skipped some class Monday and Tuesday, sometimes a handful of them, sometimes as many as 10, out standing on a corner across the street from the school.
It is important for the school board to know that we are against this. They cannot get away with this. These are books written by people like us, queer people, LGBTQ people, maybe just Margaret Atwood, because they banned The Handmaid's Tale. We have a right to read these stories, and we have a right to judge them for ourselves.
Well, then on Thursday, we heard from a Nampa High School English teacher about this. Brian Coffey, also president of the Nampa Education Association.
The biggest problems is the process itself, and that it was a unilateral decision that was made that didn't really involve much of any kind of due process. The consensus is that this is not the way to engage in addressing controversial issues.
Okay, so those stories prompted these text messages we didn't have time to share until today, like this one from Anna Lee, who sent it in yesterday. She said, "I'm curious, did the people that banned the books in Nampa schools actually read the books cover to cover, or did they just read only the controversial parts?" And this question, well, that question right there from Melissa, why did The Kite Runner, why was that one banned? It's an excellent piece of literature. Well, that book in particular, The Kite Runner by Khalid Hosseini, is a story about a young boy growing up in Kabul. It was given a 1 out of 5 rating for sexual content by Common Sense Media, which is very low on that scale, because the author describes romantic love and caring adults' desire for affection, far from pornography. But that book was banned forever anyway. Well, on Tuesday, we dove into the latest Central District Health Board meeting, where the most recent appointees were leading the charge and wanted to remove a couple of COVID-related items from the agency's website and protocol when they're talking to schools. Lawyer Raul Labrador, who was appointed January of last year, and Dr. Ryan Cole, appointed last August as the lone physician on the board, convinced the rest of the group to agree to remove recommending wearing masks to stop the spread of COVID from CDH's website and in their suggestions to school districts. They also tried to remove any recommendation of getting a COVID vaccine for kids by saying things that, well, weren't really based on fact. Testimony we wanted to run by recently retired pediatrician Dr. David Peterman.
We're hearing about heart issues. We're hearing about other things that are at a higher rate than other vaccines. And I think I think those things also need to be presented to the parents. And I don't know that they are.
I think this has been one of the major problems with COVID, and that is frankly, we've had public officials or officials that do not have facts giving out information. That's not how we make decisions. I don't think any of us want to make decisions based on that. And certainly, as it comes to public health, the United States has a long history, Ada County, Canyon County, the state of Idaho, of following the recommendations of our health departments and our public health officials.
This is a dangerous gene-based shot that is not a vaccine. We cannot scientifically recommend this to anybody. I mean, I am adamant about this. This is the hill I will die on. The children are a no-go with this shot.
Let me start by saying, I don't know the qualifications of who you've just referenced. It's my understanding that particular individual is a pathologist. And I'm not familiar that there's any training of pathologists which involves treating children. I'm not interested in responding to information that's incorrect. I think that's the mistake we've made with COVID up till now. What we need to give to parents, which is what I spent 40 years doing, is give them the best information we have. And we do have good information.
Okay, so that led to this text message from Steve in Meridian, who asked this question. Who appointed the false prophets, he says, to the Central District Health Board, and how do we unappoint anyone who is not science or medically based? Well, they were appointed by the Ada County Commissioners. The Board of County Commissioners from each of 4 counties represented by CDH is responsible for filling the CDH board. And that can be someone from the medical field or one from the County Commissioners, Board of County Commissioners, or pretty much anyone, really, that they decide. As for unappointing them, that would be up to, well, the county commissioners, in this case, Ada, who appointed both Raul Labrador and Dr. Ryan Cole. These board members are appointed to 5-year terms, and the commissioners have given no indication they are looking to replace them. Of course, should Raul Labrador become Idaho's next attorney general, he might be too busy to fulfill his duties as a CDH board member, which led to this text message from Ed in Meridian. Raul Labrador sounds completely out of touch with the facts surrounding COVID. Thank goodness he'll be doing a new job if he wins in November. I mean, how much damage can he do as attorney general? Well, that one we may have to answer another day. Well, finally, since Tuesday, we've been talking about the tragedy in Uvalde, Texas, where an 18-year-old with a recently purchased AR-15 killed 19 fourth graders and 2 teachers at an elementary school. And for 2 days, we heard not a word from our congressional delegation here in Idaho. Not a word of condolence, not a thought or a prayer, not a word of what could be done to prevent mass shootings like this. We had several viewers ask us to ask them why, and several others reached out to them directly to get the answers on their own, only to be frustrated by their response or lack thereof. Like Boise mom Amy Hoppick, who tried calling Representative Mike Simpson's office several times in the days following the massacre.
I would like to hear that they're going to do something other than platitudes and nice words. I mean, I've written them many times to ask about guns. And I'm basically told, well, Idahoans support guns. I'm a lifelong Idahoan. I'm like a 5th generation Idahoan. I understand. But the guns that are used for hunting are not AR-15s.
We did reach out to all 4 of them today. I got 2 responses back today. One from Senator Risch saying there's no comment.
No comment? What? That doesn't even make sense to me. As humans, as human beings.
We did get something back from Congressman Simpson. The massacre in Texas has once again rocked our nation to its core. This is not an acceptable status quo, and we must do better for our children, Simpson said. Kathy and I are praying for our country, and especially for the families who are living the unimaginable. Hate and division are too present in our country, and elected leaders must set an example by coming together to find meaningful solutions that address the clear mental health crisis in this country.
I would ask him, I believe too that we need to bring people together, but I would ask him how he was helping bring people together when he was tweeting about Biden and gas prices in the hours after a massacre of children. I want to build a better world for our kids. And I don't, I guess we have to start on social media. Everyone's like, vote and talk to your legislative delegation. I'm trying, but I'm not sure that that's making a difference.
Okay, so we got a whole lot of text messages about this story, and this one from Colleen here said, Elise Simpson said we need to address the mental health issue, which is the true problem behind these shootings. But no one wants to try and fix that. They always just want to blame the guns, Colleen said. The only way to fix the gun violence is with our vote. This year at the general election, we have an opportunity to change. 85% of Americans are in support of reasonable gun safety legislation, but the right is blocking even a vote to vote on this issue. Our country is an embarrassment to the rest of the world, says Marilyn. Do you think our illustrious political delegation would realize the need for common sense gun control measures if one of their kids or grandkids was involved in a school shooting, asks Marty from Eagle. The problem is in the definitions of common sense. And the media is only interested in common sense around a particular gun. Banning a gun and saying it will stop gun violence makes as much sense as saying banning all cars will stop drunk drivers, says Jeff. Also, we need to strengthen our soft targets and maybe spend some cash on security measures and less on sports programs, he says. If we can't protect the kids, well, or if we can, I guess he says, the rest is garbage anyway. Why can't we just post a National Guard soldier at each school every day, armed, asked Greg. Well, Greg, there are more than 900 public K-12 schools in Idaho. And there are about 3,000 members of Idaho's Army National Guard, which is considered a part-time position, by the way, whose mission is to maintain combat readiness and domestic emergency response capability. But you want to take nearly a third of them and just stand them outside of school for 8 hours a day for 9 months out of the year and pay them how much to do that? Armed security guards, I kind of looked it up a little bit, they make an average of about $30,000 a year in Idaho. That's for an armed security guard. Is that enough for one of these Idaho National Guard members to stand guard outside of school with a gun and risk their life against someone who might be coming in with 2 or 3 guns? The gunman in Uvalde, Texas, he bought more than 1,600 rounds of ammunition and showed up to the school with 58 filled magazines. He shot more than 100 rounds out of his AR-15 in the first 4 minutes he was there. 19 police officers were in the hallway outside the classroom. None of them went in. They were afraid they would get shot. So I guess it seems like maybe an armed guard isn't the Band-Aid we're supposed to believe it to be. Well, after a week of news that has all of us hugging our kids and family members a little bit harder with both arms, it might be nice to revisit a story we told you this week about a woman who took caring for others to a whole nother level, which is appropriate since she did it in Idaho's mountains, higher elevation and all, and a pioneer in her profession. Marie Osborne knew from an early age she wanted to be a nurse, and she became one, but then she got married, had 5 kids, and then her focus was just on the family. Well, her family moved to Idaho in the 1960s, and they would camp every summer in the Sawtooths. And there, Marie saw the need for health care in Idaho's backcountry communities. She not only saw it, she did something about it for nearly 30 years, which is why Marie was honored by the College of Idaho graduation ceremony on Saturday. On a mid-May, mid-morning Saturday in Caldwell, the College of Idaho class of 2022 files in to begin the next chapter of their young lives. Among them is a 91-year-old.
Congratulations and thank you for all that you have done.
Well, thank you.
Who wasn't really much for following others.
An extraordinary trailblazer in the state of Idaho and really across the world.
And whose chapters already written could already fill a book.
She started the first medical clinic in Stanley. She is Idaho's first ever nurse practitioner.
Wearing a graduation tam and gown is not how Marie Osborne saw herself 5 decades ago.
My mom said since I was a toddler, I always wanted to be a nurse.
Neither was pioneering a profession part of Marie's plan. That path presented itself while on vacation in the Sawtooths.
Then there was a terrible car accident up there. There were 4 kids involved, and it took a very long time to get the ambulance from Haley. And she said, you know, someone needs to do something about this. Someone needs to do something about helping these rural communities with health care.
That someone would be Marie, with some help from Idaho lawmakers in 1972.
At that time, Idaho was the first state in the nation to license nurse practitioners to try to respond to the needs of rural communities. Mom was the first licensed.
With that new license, the 41-year-old mother of 5 opened up Stanley's first emergency clinic on June 19th, Father's Day, 1972. They were even able to add an ambulance, a '58 Pontiac.
We paid $300 for it.
At first, the focus was crisis care.
Well, it's a huge tourist area.
And, well,
people do some of the dumbest things in the middle of the night.
But then
people start coming in for their allergy shots and blood pressure checks and chest pain, and that's, so, you know, you sort of have to end up being a jack of all trades.
She's the sole provider for about 6,000 square miles of backcountry.
The backcountry Marie may have been a bit familiar with.
But medically speaking, I had no idea what I was getting into.
She did know she needed help, so Marie put together a crew of certified EMTs.
And so Marie was offering the EMT class, and I took her class in 1975.
Steve Lippis was one of the early additions, part of what was called the Goat Patrol.
When there was an incident in the backcountry, a climbing accident, somebody fell off a horse, broke a leg, or cardiac incident, we were pretty much the lead, getting in the quickest way we could, mostly running.
Steve served on that crew for 24 years, and Marie made sure he got his certification every 2.
I think one of the things that Marie did was not only teach us the procedures and what to do as an EMT, but her compassion for patients filtered in on all the EMTs, and we developed quite a team. As EMTs, we always appreciated when Marie was in the valley because we always knew she would respond.
Marie did respond. She just didn't expect to for nearly 30 years.
You know, you don't think about that. You just start and you do, and it gets more and more interesting. I like not knowing what's coming in the door.
Not knowing was kind of the theme of the clinic's early days.
This was a new concept of a nurse practitioner. No one knew what it was, and Mom in many ways had to define it.
But it wasn't without controversy, like when it came to prescriptions or just pushing the envelope of the profession.
Well, I was doing things that had always been considered the prerogative of the medical profession, not nursing.
The problems extended to the financial.
I made more money cleaning outhouses in a summer up in the Sawtooths than Mom made all year taking care of patients.
And the physical.
In the summer, she'd be up all night with ambulance runs, and then she'd be, you know, the patients would line up during the day. And there's no one else. It was just her.
I don't think I ever cried on a job, but I cried driving home a lot.
One of the bright spots, though, was setting up a pre-med internship program with the College of Idaho in the mid-1970s.
If you've had the opportunity to work in that clinic, would you please stand up?
Through that program,
some of you I know are out there.
Marie's students learned the importance of medical care in rural communities.
When people ask what I was, I'd say I'm a super nurse. because basically that's what you are.
Today, Marie is celebrated for being anything but basic. And the woman who never really wanted a title is getting an honorary one. Dr. Marie Osborne.
Well, they didn't mention this in the job description, but
Legally blind and officially retired for the last 10 years.
you start out not knowing where you're going, and the pathway is amazing.
Marie can still impart the wisdom of experience.
Don't go where there's already a path well cut for you to follow. Instead, make your own path.
On those who lack it.
And make sure you leave a good trail. I just feel like I was doing what I was supposed to be doing.
Look at the camera.
It turned out to be a fun job.
Well, the Stanley Clinic has hosted 2 C of I interns every summer since the mid-'70s, and many of whom have gone on to medical careers. Marie left the Stanley Clinic in 1999, but she did leave it in good hands. It didn't mean she stopped working, though. She went on to help in other rural clinics around Idaho, like in Horseshoe Bend, Idaho City, and Emmett. She even worked in Boise for a time, serving those with little or no income and little or no insurance. She saw her last patient at the age of 80 when her diminishing eyesight forced her to. By the way, Marie may have been the first licensed nurse practitioner, but there are now more than 350,000 of them in the United States. The city of Stanley is going to be celebrating the 50th anniversary of their clinic, and that's coming up in October. All right, let's get right to your comments. Chuck says he is a fifth-generation Idahoan, hunted his whole life, never felt he needed open carry or concealed carry. Individuals that do, other than law enforcement, seem to have some type of mental issue in most of my experiences. People like the Proud Boys or other right-wing fanatics. People who want to intimidate others. It's time to limit guns to the range of the field. We don't need guns in public other than law enforcement. Regarding the comment about the right being a problem for gun issues, it really is both sides who won't cooperate with each other. Until they learn to cooperate, we still will be two sides, unfortunately, neither truly with America's best interest in mind, says Nathan in Cuna. If residents of Nampa don't like the decisions that the board makes, go after their jobs. I think these people are elected, right? Yes, they are. Get involved if you want to get involved with the school board. Just as Big Oil lied about how burning fossil fuels impacts our climate, gun industry and NRA tells us it's a mental health issue. When will we learn that for corporations, it's always profit over people, says Patty in Twin Falls. Kind of like the smoking industry, right?